Hi guys, Dr. Liu, I have to unmute your mic. So welcome everyone watching from MMR Facebook, DOPS Facebook, and the DOPS YouTube video. We are live, and we are having a weekly live chat on various topics to keep you guys informed or up to date on anything new. And this week we are going to talk about digital healthcare and how it has impacted our lives. Especially, we are in pretty unprecedented times, whereby because of the COVID pandemic, a lot of things have changed. A lot of things have become digital. With not just banking, shopping, even the way we order food has gone digital. So why not healthcare? And with me tonight is Mr. Kenneth Chang, who is one of the founders of 65doctor.com. They have a presence in both Malaysia and Singapore. And they have a product called Avixo, which is a cloud-based electronic medical record. And also with me tonight is Dr. Liu Kongfui, who is a general practitioner and also a user of cloud-based EMR, and we hope to have him share his experience. So we'll just have this will just be an informal chit chat, and we'll share with you our thoughts and experiences about how digital healthcare and cloud solutions will are helping doctors and patients in this critical times where we are dealing with the COVID pandemic and the need to change SOPs and social distancing and whatnot. So I'll hand over first to Kenneth. What are your views? What have you seen? What changes have you seen this year? What's the impact been like?
Sure. Thanks, firstly, Dr. Tay, for organizing this. I think it's a great opportunity for everybody in the industry to sort of recollect and to receive some feedback. In the last few months with this COVID pandemic. Obviously, all of us have had a trying time, both businesses, doctors, and patients. So I just wanted to go through a few points that, us as a company, right, we are in a pretty unique situation because, we deal directly with doctors and clinics, right? So, we kind of get a firsthand sort of whisper and conversation, right, with business owners, with doctors who are interested specifically on the medical side of things, as well as on the operational side of things, to what changed in terms of their functionality needs. Are there any urgent new solutions that really piqued their interest because of the way things have changed, right, because of social distancing and the COVID pandemic. So I have a few points that we have collected from our supportive doctors and clinics, on a very high level, right? To just pinpoint on within this discussion, about 10 minutes, not too much, and it'll just basically highlight the majority of the requests, the feedback that we get from our clients, and how that specifically touches our solution in terms of what functionality we can provide on the technology side. So I think the first most pertinent conversations that we've had with a lot of our clients was the need for some level of virtual engagement, right? Because of course with MCO, with lockdown, physical face-to-face conversations and consultations are very hard to come by. So I'm sure everybody that's listening in is not unaware, right? The need for telemedicine, virtual care solution was extremely relevant in this time. And so particularly when we're talking about telemedicine in this respect, it is not to delve too much on the medical aspects of things, but just the ability for doctors to reach their patients by using a simple, easy to use, user-friendly, cost-effective, right, virtual care solution, which by and large sort of circulates around the need for video, right, and chat sessions, right? And so obviously the request was asked immediately, right? For a lot of doctors and a lot of healthcare providers out there, right, they suffered greatly in terms of patient flow, right? We saw numbers come down quite significantly in terms of inpatient visits, right? And they wanted to ask themselves, okay, how can we further engage the needful, right, and the needy in terms of providing healthcare, right? So I think that us as a company, a lot of people ask, they would say, can I use Zoom? Can I use WhatsApp? Can I use Skype? I mean, effectively, a lot of the solutions were already out there. But one of the, medical legal concerns was, the encryption of data, the efficacy of the solution, right? How well do doctors take to, having conversations on certain platforms that are arguably a little, suspect in terms of how closed loop they are, right? So, we as a technology company spent a lot of time talking to people through networks to sort of understand. Of course, there are solutions that are already out there. Why not we just piggyback on them, right? Telemedicine is not in any way a new concept, right? For many countries, it's been around for decades, right? But in that light, we actually, decided to focus and provide solutions that were not born from our company alone, right? Because of timing, because of cost, because of efficiency, we searched the net, we talked to some people, and provided free, easy to use solutions for our doctors. So telemedicine definitely was the forefront concern, for the ability for patients especially as well, right? Not just the doctors, but for patients who really needed to see, their practitioners who are not COVID patients, but who may be chronically ill, who may have emergencies. They felt a real need for this, right? So it was important for us to do our homework and get them engaged on easy to use solutions, which there are a whole bunch of solutions that are out there. The second thing, is sort of the need for information exchange in general. So, we had a lot of clinics that were exploring, the need for e-registration, online registrations, for example, so that, this would allow clinic wait times to be reduced. Of course, with social distancing, that was important. The importance of providing, let's say, electronic medical certificates, right, for virtual consultations that were relevant for complete employees who didn't want to or who couldn't, right, travel to visit their practitioners. Even to the extent exploring the ability to work with other vendors in the digital healthcare space to provide delivery of drugs to patients' homes, right? E-deliveries and e-prescriptions, right? That can be sent to pharmacies, that can be sent to vendors who can provide the solution, even contacting and working with logistics companies to send such drugs over. These are solutions that were very important, right, during MCO, and they continue to be, right, because from both sides, from patients and doctors, there's a distinct sort of handcuffing now of going back to the way things were pre-COVID. And tied to all this information sharing, there was even the simple request of letting their patient base know a change in clinic operation hours. A simple, information sharing solution needed to be created, right? Whether it's a WhatsApp blast, whether it's a SMS blast, right? Well, these are things that given that doctors, clinics, and our businesses alike, they needed to be very aware of exactly how they could manage the continuity of their business, right? And at the same time, let patients be aware, right? If they're going to go out and step out, of their homes to travel to visit doctors, they don't want to have to go there and be disappointed, right? That they couldn't receive any care. So especially for the elderly, for the people who are less mobile. So all these requests sort of gave the company a very interesting retake on what types of solutions we needed to provide. Of course, we continue to develop and listen to our clients on improving the system operationally, but that was under the huge premise that you had an operation within a physical space. And given all these requests, we were forced to sort of think about how we could provide virtual information data exchange solutions, right, to satisfy the new normal as it is now. And so I think as we continue to see this COVID situation extend on, we don't foresee any drastic changes back to the way things were, right? There needs to be a sort of systemic change in terms of how healthcare is delivered, right? And especially how information is exchanged, because in the old ways, it's very difficult for that information exchange to be executed in local closed loop systems that are perhaps not cloud based. And I think this whole aspect of information exchange is also tied to the need for education. Educating the public about COVID. Especially with vaccines, access to vaccines, costings. These are things that if you, whether you like it or not, you have to be aware, right? From the community perspective, from the business, as a corporation, and even within a family household, how do we manage COVID cases, and how do we prevent ourselves from getting into that black hole of dealing with COVID recovery. So a lot of doctors are looking to post to talk about these solutions, to expose, right, these good solutions to their patients, to the existing patient base, to people who are not their patients but maybe relevantly involved, right? And I think that continues to be a very important aspect, because in Malaysia, there is a large population. Not everybody is aware, as much as the government is doing a great job in trying to manage education exposure, right? The doctors have a huge role to play in that aspect, and so technology can be very useful in terms of providing that education exchange. And I think the last thing, which is I suppose a little bit more on the business side of things, is the need for electronic payments and transactional banking solutions. Contactless payments in clinics, the ability for those transactions to occur wirelessly, is something that of course we are so used to doing with shopping, with even going into retail, not using our MasterCards or credit cards. Payment gateways are important, right? In order to uphold the professionalism of doctors, and to make patients feel safe that they're getting good quality service. So that was also a functionality that we're looking and we're building to allow everything to sort of circle within one ecosystem. And I think that generally speaking would help in this new era. And I think that there's a whole bunch of other requests, other functionalities that may be more specific to specialists, more specific to certain group practices that have multi-locations. There's a laundry list of technology needs, right? Which is positive, and hopefully can shine a light on the situation going forward, because the hesitancy towards digital healthcare and the need for that change may in a roundabout way be positive because of COVID, and hopefully we can be a part of that solution. There are so many great companies in Malaysia, worldwide, that doctors are comfortable with, and we intend to work with people. We don't want to be one-stop solution for everything, but we really want to try and ultimately listen to what is needed, right? And with that request, hopefully we can fulfill, and at the end of the day, reduce healthcare risk, right? To make everybody healthier, and I think that's always been the end goal for the company.
Oh, thanks for summing it up, Kenneth.
No problem.
No doubt that COVID-19 has caused a surge in virtual consultation. But as I dealt with my earlier video on teleconsultation best practices, I think one of the most important things for we as doctors, if you are going to engage in teleconsultation, is we need to have access to our medical records side by side. I mean, don't ever try to have teleconsultation and then try to rely only on your memory.
Sure,
of the
absolutely.
Details. Yeah. You can slip up and make mistakes, and this is why doctors like to tell patients, "I'm sorry, phoning in anytime and just want some advice. It's just not on, because we really have to be professional. We have to set the time aside. We have to have access to the records at that time, so we can actually give meaningful advice. Of course, there are certain limitations, but the regulatory authorities, the Malaysian Medical Council, and even the Professional Medical Indemnity have recognized the need for virtual consultation, and there's some basic framework or advisory for doctors who want to do so. But I think having an medical record on hand is good, but paper records, I mean, it's really clunky. Electronic medical record, I think if it is standalone, it's okay, but it doesn't have the flexibility of a cloud-based solution. So sure. I think, Dr. Liu, you've had some experience, you were telling me, with the cloud-based solution. Were you using a standalone solution before that?
Yes, Dr. Tay. Thanks for having me, and thanks to the DOPS network as well. So in reply to that, I previously, as a solo GP, being only about a few years into establishing, we did start off initially with an offline, non-cloud-based CMS. So I think I've only been on Avixo for about half a year or so, but I don't, I don't really regret that decision at all. In the sense that I find the accessibility when I'm not physically in the clinic, because of the sheer virtue that it's internet and cloud based, is actually something that is very valuable to me on a daily basis. I didn't actually realize how relevant it would be until I actually made the jump. Yes, as I was telling Dr. Tay earlier as well, I think that there are quite a few salient points that make it, more seamless. Like sometimes when I do want to access some inventories, or when I need to monitor certain operational activities when I'm not physically in the clinic, it's possible to do it on the fly, and I think there's a lot of value in that.
And I think people, doctors, whether you're a GP or a specialist, if you work multi-location, having access to a common medical record stored in the cloud, I think it's advantageous. And if you're having telemedicine sessions outside your clinic, you can put it in, and then you can update EMRs or whatever EMRs you're using. Say if your clinic or hospital is a separate system, you could easily copy and paste and update whatever you've recorded. I mean, the basic premise is whatever we're doing on teleconsultation, we'll have to properly document the session. But having a whole solution, as Kenneth mentioned, something where patients can register themselves, book appointments. You can actually have a calendar where you can see who's coming, who hasn't come, and I think patient recall, I think, is very important as well. I think continuity of care, reducing defaults, and especially for NCDs or long-term illnesses where it's very important, I think. But managing all this data, as Kenny saying, there's a whole load of information we need to come into grips with, and paper records these days, I think it's extremely problematic. But Kenneth, what about the existing GP who has a whole bunch of paper records and wants to migrate to an EMR? What like Avixo, for instance, what do you advise?
Yeah, I think that's a good question. I mean, we actually have a lot of clinics that are, keen to make the transition, but I think it's always a challenge because, technology is not as advanced to, multi-scan paper records within, half an hour, and all of a sudden you have, access to them online. So the whole idea of this is what we call scribing, right? In the US and in the rest of the world, the scribing business is massive. Even with doctors who are in hospitals, in environments, right, that end up having to spend after hours noting down their case notes. The companies get employed and deployed to actually do this solution for them, and those solutions maybe are things that are related to instead of writing, right, just sort of audio, voice detection, solutions that make it that much easier. Not significantly, but could reduce, scribing wait times quite significantly, but we still haven't, I guess the industry still hasn't found a great transitional solution for that. I think that in many countries as well, right, in India and in parts of Southeast Asia a lot, the handbook and the medical record book is still very very relevant in terms of practical use. So, we try our best to again piggyback on solutions that we know on companies that have these scribing services, right? That do patient upload records, from manual to digital in a very controlled, very safe and secure manner. Not the quality can be passed in the court of law, for example, in terms of viewing your digital records when you do transfer them from paper. So these solutions and these companies to give doctors and clinics peace of mind, right? When it comes to a digital sort of transformation is very important, because the biggest feedback we get from doctors who do want to switch is just the medical legal risk, right? What is the risk of patient data sharing, patient ownership? Where does it get stored? These are all very relevant questions, which our business and everybody in this market has to answer with the help actually of regulation, of government and of the higher power that allows us to sort of work within certain guidelines, and again, it comes back to this general sort of takeaway for what I've been trying to say, at least in these few minutes, is the ability for information and education to sort of play a very strong part in terms of digital technology in healthcare.
Yeah, but once things are transcribed or available digitally, the power at your fingertips is immense, isn't it?
Yeah, I mean,
generating
I think
reports.
and I think it ultimately, if you look at statistics, there are so many cases that we hear from doctors that say, I need, like you said, I need the patient history. Even if it's an emergency situation, I can't just operate. I can't just go into surgery without understanding the risks. You're talking about patients' lives. So that transferability, the access at your fingertips, people are already very used to it. Even in companies situations, now that we're all working remote majority of the time, we use Google documents, right? We don't use Microsoft Office that's in our computer, we use things that are on the cloud. And of course, you have to go with the trusted partners. You have to go with the right people who can give you that peace of mind and comfort to make the transition. So I think it's always important to listen to the crowd, listen to their concerns, and try to answer them in as professional way as possible. And whoever has managed to make the leap, like Dr. Liu, I'm sure he has some positive things to say about the transition, and at the same time, also, a lot of improvements that all these companies and digital health solution providers need to make. It is still an evolution, right? Like you said, of going from the old normal to the new normal, and with COVID, it may accelerate things. It's a big question, whether doctors and clinics still may revert down back to the old way of things. This is a cultural sort of, I guess, a very culturally relevant sort of stream into the new normal. You have to be very aware of, how do patients even think about this idea of talking to doctors online. With the help of Internet of Things, wireless devices that can track your vital signs, perhaps. These things that the more and more that those become relevant in the market, the more and more affordable they are. I'm sure that digital healthcare will take a significant leap. It may not be immediate. Healthcare is an industry that takes time, years and years of medical perspective. But with technology, hopefully it can speed things up. But yet to be seen. We are all in the same sort of environment, and we're just here to try help. And that's the bottom line.
So, Dr. Liu, have you had the occasion for either practicing virtual consultation from home, away from your clinic, and then with the ease of accessing the electronic medical record, or any instance where you actually need to refer to the patient's medical record? Has that surfaced in the last couple of weeks for you?
Yes, most definitely. I think that on occasion when my colleagues are running the clinic, when there arises a situation where they need some kind of discussion or some joint decision making amongst clinicians within the practice, it's certainly very convenient to be able to have that data recall element very accessible to wherever I am. So if I'm at home, I can just retrieve it from my laptop, and if I'm not, it's even possible from any browser, Chrome on my smartphone even. So I find that that element is actually can't be underestimated. The actual deployability of it. Furthermore, I do think that like what Dr. Tay did mention earlier, when there may come certain situation, if a certain patient need to communicate and I'm not physically in clinic, sometimes it is possible to have a quick, very simple on-the-fly exchange. Generally, as a rule of thumb for myself at least, I try not to communicate too much if I'm not actually physically in the practice. But sometimes the situation may arise, and when that happens, then patient data is always accessible at the fingertips. And I think the best part is that it's very intuitive. I like that there is a telemedicine integration component as well in the CMS, which was added recently, which actually helped to make these teleconsultations a little bit more seamless. And yes, I do carry out certain teleconsultations as well. However, it is generally within the recommendations of what we would accept as a very safe practice. I think at least from my practice initially, we were quite cautious in that we would have staged how we do it. And I think naturally speaking, it's quite a learning curve as well for anyone who's moving into like teleconsultation. So naturally, we did kind of proceed with quite a bit of caution initially, and we would start out with our very regular patients, mainly for patients who needed follow-up for like NCD conditions, and then those that would contact us for first-time visits, we would just say, no, you need to come in physically. And I think that one of the things worth mentioning as well, as I had mentioned with Dr. Tay, was that the calendar functions, being able to schedule cases will prove to be quite invaluable for us, because that helped us to set a reasonable amount of pacing for our appointments. And in a way, it kind of reduced the crowding physically in clinic. And that kind of given our existing patient pool some confidence that we were taking certain precautions to reduce the risk of infection during these new normal times. So I think that's certainly did help us with continual community engagement as a community-based practice.
I like what you're doing, because it is what the MMC has stated in its initial advisory for teleconsultation, which is actually basically perform it for your existing patients. That means it's follow-up patients, not so much for first consultations. And then I think that one of the most important best practices, if you feel you need to examine the patient, then you have to defer to a real visit. Ask the patient to come back to the clinic.
Absolutely.
But there are a lot of aspects of consultation where you can, do it virtually. I mean, it could be just some counseling, some explanation about blood tests or something. All these things can be done virtually, which you do not need a physical visit. But coming back to this, having information at the fingertips, whatever it is, I mean, for those of us who are hospital-based, and then we are using the hospital EMR, if the hospital doesn't give your consultants or specialists access to the EMR when they're home, I think it's a huge handicap. I can tell you, if any hospital administrator is listening to this, if we get called by the emergency room, and the ER doctor tells us, Dr. Tay, you remember Mr. So-and-so whom you saw 6 months ago in the clinic, and now he's here with this problem. It gets me to no end, because they expect me to recall, and I can't access the medical records. It's just, in this day and age, is not on. We really need a cloud-based solution. We need a solution which is your doctors who need to know, about the patient, we need to refer back to our records. And then if you're actually asking the doctor to partake, as you said, your colleagues, Dr. Liu, your colleagues are asking you want to discuss something about a patient whom they are seeing now, but you may have seen 2-3 months ago. If you are unable to access the records, how can you have a meaningful discussion? And then how can the patient's management be meaningful? Same thing for hospital-based doctors. I think this day and age, where I think it really needs to be cloud-based, you really have to give your doctors access to the information whenever, wherever. Of course, the hospital will say we are concerned about security, access, but this is all technical, isn't it, Kenneth? If somebody asks about Avixo and they're concerned, it's cloud-based. What about security and privacy? How would you reassure the doctors?
Yeah, I mean, like you said, I mean, it is a concern, like I mentioned before, and a lot of people do ask the question. And you kind of have to provide the best, most professional answer, which is deploy the best practices in the industry in general, right? Use the top servers, get encryption for data, have firewalls and have certain sort of restrictions on access on patients. To be frank, I mean, and very objective, I will never say, and I don't think anybody will, right? That whatever is on the cloud is unhackable. In Singapore, you had Sing Health attacks twice. In the U.S., in every single country, you do have you do face these issues, and at the end of the day, it is not something to brush off. Don't get me wrong. I think patient health data is probably the most sensitive data that anybody can hold. But to the best of our abilities, to the best of the industry, in which a solution can be provided to prevent any of these mishaps, we invest in that. It is not cheap. It is not necessarily something that would make economic sense as a company, but like a lot of things, you kind of have to bite the bullet, right? You have to do what's necessary and needful for change to happen. So we definitely believe in that, and the reason why is because our clients are the people we listen to, right? So everything that's related to the business is putting a very close ear to the ground, and the more discussions we have, the more conferences we attend, and the more we listen in on video chats and whatnot, we hopefully will get to a point where there's a very generally understood way of practice for digital healthcare to thrive. And I think in Malaysia, a lot of promise, and especially in the region of Southeast Asia in general, because Malaysia does boast a good selection of pre-COVID medical tourism, from neighboring countries, which will continue to be of interest from the public and from the patient side. And of course, elective surgeries and whatnot are we're not at the stage where you can virtually solve those, but at least to provide a better gateway, a better sort of connection to get patients the right care and the right advice. Second opinions and whatnot is still a very, very large aspect of healthcare, value in terms of being a practitioner. And I think that continues to be, it's not going away, basically. And the more global people are, even with the pandemic, I think, technology will serve a very solid pillar in allowing this global trade to occur, right? It must, and this will be a very good test case. How we come out of it as a community, as a industry as a whole, right? It's certainly not going away, and at the end of the day, we're still human, so we have to take care of our health.
Yeah, there's a question from one of our Facebook doctors, and he says,
Sure.
Digital healthcare model run by the middleman, the non-doctor in the background, is an area of concern with regards to ownership and control of patient information. So
Sure.
that's his concern. What are your comments?
So well, for our company specifically, we are actually founded by a doctor. So that's a very important first comment I would like to make. We are not technology people. We don't consider ourselves that per se, so the doctors community in which we engage with, we hear it from the perspectives of doctors. Now, you're right. I mean, let's say patient data ownership, right? If you think about a hospital system, even, right? Your hospital information system is owned by Epic, Cerna. These are independent, private-owned companies in the US. No different as a concern, let alone talking about the situation with a cloud-based CMS and EMR, company, right? Whether that gets housed, whether the data can be accessed by certain people. Like I said before, it boils down to the security and privacy procedures that the company itself undertakes. There have been cases where patient data sharing has been leaked. There's no doubt about it, right? But like I said, I think we would sort of be shooting ourselves in the foot, and we'd be lying to ourselves if we went back and ended up being the same problem as when it happened before. So we obviously have no intention of doing that, and we just deploy as much as we can to allow that at arm's length ownership, right? We are not the owner of the data. We as a cloud-based solution, Apple, Amazon, Microsoft, Alibaba, they own data too, you can argue, right? They have data on this call, they have data on our WhatsApp chats, whether it's encrypted, whether they can access it, whether they can do things. Even myself, as a consumer, I'm not sure. Sometimes I get added ads on my Facebook for when I'm talking to my friends on WhatsApp about the same topic. They say it's encrypted. I don't know. So it's a tricky situation, answer to fulfill. To be very frank, I mean, I don't think I personally have the solution, but as a company, we just try to do our best and keep our ear to the ground on how solutions can be at arm's length, right? And
can your system say, if I want to migrate to another system, could I get all the patient information down
of course,
and then get it exported to another system?
Yeah, I mean, we that's one of the things that we don't hide behind. We believe strongly that the patient data, in fact, actually is owned by the patient, number one, and the doctor has that first right because of that doctor-patient understanding, right? On the medical side, on how things are shared. So we already in our solutions, you can download all your patient information. You can export, you can email, you can print all the data that resides in it. We are not to the doctor's question and point. We are not medical practitioners. So the data that you hold, we can't. We wouldn't know what to do with it anyways. We know that it's important, and the transferability of that data is very critical for solving healthcare solutions, right? I mean, being able to understand the history of a patient, but whether that can be turned into AI solutions or something that could be a continuous care solution is still yet to be seen. Companies are already doing that with anonymized data, which I think is okay. I don't think there's a problem with that. To have the proper data sets for continuity of care with the help of AI, not to replace doctors but to assist them, is definitely the future. And it may not be it may not consume the entirety of a doctor's relevance. I don't think so at all, but it will certainly help to reduce, improve efficiency. Yeah.
As far as where your information is going, the government is already collecting it, isn't it? In Malaysia, there's a national data clearing warehouse where hospital EMRs are sending all the data to the government central system so that they can collect statistics. Of course, they say privacy and there's anonymity and all that. So I think it's for national health data. So it's already going everywhere, but hopefully in secure fashion. I'm reminded that there's this low-tech solution about patient information and data sharing in government hospitals, especially. Patient is given this little book, 555 book, or this little book where the doctor writes it in and the patient takes it home. And the next clinic he goes to, he shows the doctor as well, and they make little annotation. Dr. Liu, I'm sure you've seen that when you are practicing government.
Yep.
It's wonderful as long as the patient doesn't lose the book in floods or something like that. But actually, it works. If the patient sees me and shows me the book, at least I have some idea what's going on. And that's true case of patient ownership of the data,
Sure.
but of course it's
Absolutely.
non-digital and it's very hard to sift through, especially the book is like very thick and full of information. It's difficult to go
Yes.
through.
Yes.
I also like to think about the way the data or the EMR is designed. Dr. Liu, what if, I think ease of use is one thing. And I think as doctors, from the doctor's perspective, we will know whether it's actually designed for use by doctors, or in the case of many commercial solutions, I suspect it's designed for accountants and bean counters. They're not really
Yes.
designed for ease of use by doctors. And I think if you use different type of EMRs, you know what I mean.
Yes.
It's actually
Yes,
not
Doc.
designed for clinical flow.
I think,
So I like a
yeah.
well clean EMR, which is actually designed for clinical use by your doctors, by your nurse, and so on. So I have no shares in your company, Kenneth, but I can say your product is designed for use by a doctor, and it's
I
very
think
clean. It's easy to use. Yeah, I have to say
one
that.
of
What do you think?
yeah. I feel that one of the useful things that they recognize is that clinical practice, it's a dynamic thing, and it does evolve as the patient demand evolve in order for us to effectively do our jobs. So I really I think one of the good points is that they take on a lot of recommendations and advice and input that as practicing clinicians, we tell them, and then they take it on board and they process it, and then actually you can see it being reflected on the system pretty quickly as well if it is something that's very relevant, which really helps to improve the workflow. I mean, just within the 6 months of joining, I do think that there have been a few key and significant changes that have helped to make things more intuitive and self-explanatory in terms of clicking around. And that really helps a lot because, as what Dr. Tay has said, I do think that sometimes some of the CMS are not as user-friendly for a clinician, and that is like probably in the middle of like a busy clinic day, that's like the last thing you want to wrestle with.
Those things were designed by an IT programmer. Is the worst thing without the doctor in mind.
Yeah.
But how I
There is
think
that
in terms
dynamic,
of
yeah.
local requirements, like say you need to generate certain things when the regulatory body comes inspecting and things like that. Your DA drugs and so on. Do you find it so? Is that important aspect for an EMR that is localized to the needs of the Malaysian practitioner? Or do you think that's
from
not
important? Yeah, no, I think from a primary care perspective, definitely having the information more organized in very organized records and very retrievable, accessible records definitely is a plus point because when authorities do come to check, it's normally very easy and very accessible for us to be able to retrieve the information that they want. And that actually makes things a lot easier for them, and it makes things easier for us as well. So yes, I do think that definitely local regulation and what they actually require to comply with definitely does play a big part. And it's great that I think that the Avixo team actually have taken this on board in a very dynamic way as well. Yeah, I
the
don't
other
hold any
thing,
Avixo, by the way.
Kenneth, I think our health minister had said they want the previous one or the current one, I can't remember. I think the previous one, they said they were wanting the whole country to have electronic medical records eventually. I think it's like a very wishful dream, but I think it's like I have a dream. Yeah, I think everything should go electronic eventually. But what do you think?
Yeah.
You think that will happen? Do you think it's going to be one platform or different platforms talking to each other in a?
It definitely has to be an ecosystem of solutions. The only use case I can think about that has managed to do that successfully because they started that way is the NHS in the UK. It was founded on the whole idea of just socializing the solution. You see, and of course, as a result, everything is transferable, and they can benefit from that solution in this current time. For most other countries, almost all of them, they, even in the US, you need the help of government. You need a good level of regulation to instill the solution across many players. And those players have to see that the collaborative value of the integration is far supersedes being independently an independent winner. I think that mentality is also very important to stress with businesses, even though everybody wants to take over and get the lion's share of a solution. In healthcare, because of the way things have evolved and the way incumbents, whether it be insurance companies, TPAs, governments, pharmaceutical companies, have already sort of defined the way things are done. It's very hard to have one winner. If it were to be a winner, it would probably be the government, right? The government that would have the saying power and the ability to instill a new normal, right? But in the private sector, for companies like us, for telemedicine solution companies, for people who are providing wireless solutions and AI, all of this eventually needs to come together at some point, which is why we don't shy behind working with these individuals and these companies. At the end of the day, like I said, nothing makes us happier than seeing a solution work. It doesn't necessarily need to be us. Of course, we have to do it to a large extent internally so that we can survive as a business, but we are more than happy and always willing to collaborate. Collaboration is critical, especially in healthcare. So hopefully, from what I've seen with a lot of companies we've engaged in Malaysia and in Singapore, it's been very, very positive. There's everybody has a great aspect of a solution that can contribute to entire optimal environment, and hopefully the companies can continue to work together. That's also I think critical if we were to get the ideal situation in front of our eyes, within a feasible amount of time. But I think definitely COVID has been advantageous to that respect, because from the business side, from the stock market, from the innovation side, everybody is talking about digital health, right? It is the hottest topic in the last 3 months, just because of the need, right? Turn on any news channel now, international, local, you're still talking about COVID. It's going to continue this way, and hopefully people can listen in and really try to solve the problems, and I think that's the most important thing going forward.
Yeah, and we've taken almost an hour, and it has been very good discussion. Maybe I'll just close by saying what my dream is. My dream is all practices should be digitalized. Digital practice, we can communicate through some common standards. If I discharge a patient to a GP, there will be a continuity of care document, which can, you can upload, and then the patient details go into your EMR. I agree with Kenneth. I don't think there would be ever a single EMR system for the whole country. It's difficult, but at least some common standards and integration. I wish for the day when I no longer see little scripts of paper, where patients refer to the specialist, scribbling down, the referral can be digital, right? And the communication can be digital between GP and specialist, and the records also transferred to and fro that way. It's far more efficient, and and the way we are practicing has changed, partly because of COVID, and I don't think these changes are going to go away. I don't know if it actually improves the efficiency, safety of patient healthcare, all for the better, right? I don't think anybody needs to be afraid. Yes, Dr. Liu, sorry.
I don't think that. Sorry, I do think that there is a growing amount of report anyway within primary care that it is becoming quite a convenient option to offer safe continuity of care. So I guess for me, at least my 2 cents would be not to be too apprehensive about adopting some kind of meaningful change, as long as it's done in a safe and calculated, controlled way.
Yeah. If I had a paper practice and I wanted to upgrade to a digital one, cloud-based one, I would probably start with a clean slate. And each patient comes in, if it's an existing one, probably do a summary, by myself, and then at least get to understand the patient better. This scribe thing and transcribing all your paper records probably is too immense a task unless your practice is very new. But okay, so this is great conversation, gentlemen. There's a question again from Dr. Lim. Next week, we're going to have part 2. And that's going to be a specific discussion on teleconsultation and telemedicine with a colleague of mine who is in the telemedicine business as well. So I think it's more specific to teleconsultation, whereas today's was more on digital health, electronic records, and I think how they're impacted by the way we have been impacted by the COVID-19. So, gentlemen, thank you for your time, your interesting thoughts and participation. So this will be hosted in Facebook and YouTube. Feel free to continue to post any questions. We'll try to answer them. And for the doctors in DOPS also, please do take the opportunity to explore a cloud-based EMR. I'll post the link to Avixo, which has been supporting doctors in the cloud EMR era. I think it's something worth considering if you are still in a legacy solo practice with a maybe standalone system, maybe something to move on to. Okay, any last words? Otherwise, I think it's been a great night. So we'll end the live broadcast, and we'll see you again next week for part 2 on digital health and telemedicine specifically. Okay, Kenneth and Dr. Liu, thank you very much.
Thank you.
Good night.
Thank you. Good night.
Cheers.